Hello, I'm Dr. Phil Quartana. I'm a research psychologist in the Center for Military Psychiatry and Neuroscience at the Walter Reed Army Institute of Research. I'm also the lead for our research initiative into the behavioral and public health impact of the COVID-19 pandemic.
My name's Dr. Amy Adler, and I'm a senior scientist at WRAIR. WRAIR has a long history of fielding rapid response teams to address specific concerns that units have about behavioral health. These teams have deployed to Iraq and Afghanistan. They've worked with units in Djibouti and Republic of Korea, and they've even included an advisory team that surveyed units deploying to West Africa in response to the Ebola outbreak of 2014.
So our latest advisory team was formed to address the impact of the COVID-19 pandemic on soldiers across the globe. The pandemic has created significant disruption to everyday life. The military is not immune to these disruptions. The Army has instituted a number of public health measures to stop the spread, but also must continue training and operations to maintain force readiness. To date, no one has thoroughly studied the behavioral health impact of the COVID-19 pandemic and related concerns on the adjustment of U.S. soldiers.
This advisory team was a collaboration between WRAIR and the Army Public Health Center. We joined forces in sharing our expertise and were able to move quickly to create an online survey tool that reached thousands of soldiers.
That's exactly right. In doing so, we developed the Behavioral Health Advisory Team, or BHAT. The BHAT developed an online survey that assessed outcomes in 4 targeted domains: behavioral health, such as depression and anxiety, public health and information gaps, leadership, and the impact of COVID-19 on families and relationships. The survey took place in May of 2020 across 3 continents. 20,000 active duty soldiers completed the survey. Our survey revealed a number of consistently reported stressors, fears, and concerns surrounding the COVID-19 pandemic. The top 5 were time with friends and family, the inability to participate in social engagements, changing rules, regulations, and guidance related to the pandemic, someone close to them contracting the virus, and the potential impact on unit readiness. The next question we had was whether these stressors, fears, and concerns had an association with the likelihood of screening positive for a behavioral health problem. We use validated primary care screening measures for behavioral health issues, such as anxiety and depression. Generally, we found that positive screening rates for any behavioral health problem were generally within range of what we observed from contemporary pre-COVID-19 samples in which similar or the same survey instruments were used. So that was good news and suggests that screening for behavioral health difficulties with related impairment in social and occupational activities has not risen significantly from pre-COVID-19 pandemic levels. However, we did observe that soldiers who reported more concerns were more likely to screen positive for behavioral health difficulty. In fact, those with the highest levels of COVID-19 fears and concerns were 4 times more likely to screen positive for anxiety or depression than those with the lowest levels. Soldiers are largely reporting that they're following the recommended public health behaviors to stop spread of COVID-19. That said, we have identified some areas for improvement that could be addressed through targeted public health messaging. These behaviors were endorsed as never engaged in by soldiers: staying at home, avoiding crowded places, going to crowded places, monitoring themselves for symptoms, and avoiding social gatherings. We also asked soldiers about what types of information they wanted about COVID-19, and we identified 5 key areas. They wanted more information about travel guidance and regulations, facts and statistics related to the COVID-19 spread, how to protect oneself, maintaining mission readiness during COVID-19, and daily life coping and stress management. This information is extremely valuable to help us shore up information gaps reported by soldiers by making recommendations for Army Public Health strategic communications both globally and locally.
We also asked soldiers about their leadership. We asked them to rate their immediate supervisors on a range of behaviors related to promoting health and adjustment during COVID-19. As you can see, there were some behaviors that were reported by the vast majority of soldiers and some that were reported by about half. For example, about 70% of soldiers agreed or strongly agreed that their leader encourages us to report any symptoms of COVID-19 we might have. 63% agreed their leader leads by example in following health guidelines to reduce the spread of COVID-19. and 63% agreed their leader has shared useful and accurate information about the COVID-19 pandemic. 58% agreed that their leader acknowledges the stress of uncertainty related to the COVID-19 pandemic, and about 43% agreed that their leader encourages us to identify what we can and cannot control about the COVID-19 pandemic. We then added all of these items together to create a COVID-19 leadership score and found that soldiers reporting high levels of COVID-19 leadership are less likely to report behavioral health problems than soldiers reporting low levels of COVID-19 leadership. And this relationship was significant even after we accounted for other factors like general leadership ratings and rank. We also found that soldiers reporting high levels of COVID-19 leadership were more likely to report engaging in preventive health practices than those reporting low levels of COVID-19 leadership. Again, even after accounting for covariates like general leadership ratings and rank. So, for example, 77% of those soldiers who report high levels of COVID-19 leadership report frequently or always wearing a face covering, compared to only 57% of those soldiers who report low levels of COVID-19 leadership. And 75% of those soldiers who report high levels of COVID-19 leadership report frequently or always monitoring themselves for symptoms, compared to about 49% of those soldiers who report low levels of COVID-19 leadership. While we can't be sure of what's causing what in this kind of analysis, these results do suggest that besides being a generally good leader, leaders who engage in COVID-19 leadership behaviors may be able to boost the health and well-being of their units. These results also suggest that soldiers of all ranks, junior enlisted, NCOs, and officers, stand to benefit from leaders who engage in COVID-19 leadership behaviors. We've been able to take results from the BHAT and from other WRAIR studies and develop a series of quick guides. These 2-pagers provide practical and specific suggestions for leaders and unit members. So, for example, there's a guide on leadership, and there's a guide on mindfulness, and a guide on sleep and managing shift work, and a guide on managing the stress of returning to the workplace. These are available on WRAIR's homepage.
And there's more information on health promotion and health protection measures through the Army Public Health Center's website.
And on behalf of all of us, thank you.